This is the weekly Health Law News Nugget from Southern Health Lawyers. I'm Rich Sanders.
And this is the Health Law News Nugget for the week of August 19th, 2019. Well, avid News Nugget fans, if you missed us, there's a reason why. We haven't done a News Nugget in almost 2 months. The Sanders family has been busy traveling around the United States for baseball, volleyball, and other assorted activities with our 3 kids, but are now back in the saddle and ready to go. And as you know, the world of business and politics and healthcare never stops spinning, and so we've got fresh news for you this morning. The USA Today reporting that for the first time, according to Department of Health and Human Services statistics, the population of the uninsured in the United States actually rose. I suppose the flip side of the coin of looking at that is that the population of the insured in the United States decreased in 2017. This, according to the Department of HHS, and looking at enrollment numbers, not just through the various marketplaces around the United States, but as reported by commercial health insurance companies and Medicaid agencies as well. Now, there are a couple of reasons behind this. This isn't in the report, but for those of you who are avid News Nugget followers, you know the trends that are ultimately at play in this reduction in the number of insured people in the United States. The first is Congress changed the law in 2017 so that the so-called individual mandate, the responsibility payment that folks were supposed to make under the PPACA, the Patient Protection and Affordable Care Act of 2010, if they didn't have health insurance for an entire year. Well, Congress changed that law in 2017 and ultimately took the teeth out of it. And so folks don't have that stick that's compelling them to go buy health insurance. Of course, along with that metaphor then, the carrot is not as significant as it was in the early years of the exchanges. The trends showing from Kaiser Family Foundation to Department of Health and Human Services statistics that the premiums for policies being sold on the exchanges are consistently increasing year over year. And so when you have no stick and the carrot isn't nearly as sweet as it used to be, it's no surprise that the population of people who have insurance in the U.S. is declining. The question is, will it ultimately overcome the benefits of the law in the first place? Since over 16 million people gained enrollment in Medicaid agencies around the U.S. After the passage of this law in 2010, and another 14 million gained health insurance through the operation of the exchanges and changes in underwriting rules like pre-existing conditions no longer be used to exclude folks from insurance plans. Will these new demographic and legal changes, will these new dynamics ultimately erode that gain that was made during the last decade? Only the knowledgeable will know, and we'll all learn together. Thanks so much for tuning in to the Health Law News Nugget. I'm Rich Sanders. Have a great week.